There are a number of conditions that can result in the pinching of nerves in the spine as they make their way to the lower half of your body and the legs to provide sensation and motor control. When that narrowing, which has the technical name of stenosis, reaches a significant or critical level, it often results in symptoms of pain, muscle weakness, numbness, or cramping. Commonly, when the narrowing is in the central canal where the nerves are traveling, multiple nerve roots can be involved. When this occurs, patients often describe symptoms that are worse when they are standing upright or walking for a particular distance. This often first is noticed in the larger muscle groups around the hips or thighs, and often is relieved when the patient stops and sits down or when they can lean over a cart. This constellation of symptoms is called neurogenic claudication. Leaning forward or sitting down often opens up the space for the nerves traveling through the narrowed area. When I suspect that one of my patients is experiencing neurogenic claudication from spinal stenosis, I always start with a thorough physical exam to rule out other issues that can masquerade as this problem, such as vascular issues in the legs. X-rays are ordered to evaluate the spine for arthritis and for any instability that can cause narrowing in the canal, and often the next step is an MRI to get a better view of the nerves themselves and to see where the compression is occurring. Once the diagnosis is made, depending on the severity of symptoms, non-operative options such as physical therapy or injections may be suggested. Often though, if the symptoms are significant and match up with the significant findings of narrowing on MRI, surgery might be recommended to open up the space around the nerves. The specific type of surgery that is recommended often depends on the particular patient's symptoms, goals, and expectations. At times where the compression is associated with significant back pain or instability, which is the slipping of the vertebra on one another, it might be that a fusion would be required at the time of decompression, and this involves placing rods, screws, or other devices to stabilize the spine. However, in a majority of cases, the problem is related to compression alone without instability, and the treatment recommended is a decompression, which involves removing some bone and disc and ligaments that are pushing on the nerves. In a vast majority of patients that I treat for this condition, I'm able to offer the most minimally invasive treatment available, which often allows for the surgery to be performed on an outpatient basis with a very quick recovery compared to the more common traditional methods. In most cases, the surgical pain is minimal and the improvement in the quality of life is immense.